seen in basal lobe or inflammation of upper lobe conjunctival lobe emphysema. Hyperinflated lung disease, shifting mesothelium, seen in basal lobe. If there is overinflation of upper lobe, then there will be conjunctival lobe emphysema. 85. Level 3 axillary lymph nodes seen in medial to pectoralis minor. Now this is level 1, level 2, level 3. This is pectoralis minor. So medial to pectoralis minor is level 2. Level 3 axillary lymph node medial to pectoralis minor, lateral to pectoralis minor level 1, and on pectoralis minor is level 2. So level 3 lymph nodes is medial to pectoralis minor. 86. Tailored unilateral ureter and child is primary microureter. 87. Unibladder in female 2 cm below urogenital diaphragm, diagnosis cystocele. Unibladder 2 cm below urogenital diaphragm, cystocele. 88. Delayed milestones, white shooters, diagnosis hypothyroidism. 89. Kidney and pancreatic calcification seen in hyperparathyroidism. 90. Sign of chronic thromboembolism in lung is mosaic pattern. 91. Chorea with caudate atrophy is seen in Huntington disease. 92. Compartmentalization of esophagus seen in esophageal spasm. 93. Primary laser question. Okay. 94. Double bubble sign, minus vomiting seen in duodenal atresia. 95. High density ascites with liver scalloping and linear right electrolytic calcification, pseudomyxoma peritoni. Liver scalloping and right electrolytic calcification seen in pseudomyxoma peritoni. 96. Colon adenocarcinoma, no mets and young. Next management, total colectomy or family screening. 97. Which is not seen in obstructive jaundice? P. Branching. Which is not seen in obstructive jaundice? B. Branching. Now 82. If humerus is above head, the head is under it, so inferior dislocation. 92. With high pressure, 92.5. Compartmentalization of esophagus seen in esophageal spasm. High pressure occurs in esophageal spasm. High pressure. 82. Humerus above head with inferior dislocation. So if humerus is above head, then the abdomen will be down, so there will be an inferior dislocation. If humerus is above head, the head is under it. Okay, so inferior dislocation. This is a mnemonic to remember inferior dislocation. 98. VQ scan used in pulmonary embolism. 99. Lower esophageal carcinoma, most common cell type is squamous cell carcinoma. EQ scan used in pulmonary embolism, and CTPA is also used in pulmonary embolism. Now, lower esophageal cancer, most common cell type squamous cell carcinoma. Squamous cell carcinoma is 81 to 95% in lower part of esophagus. Upper part is adenocarcinoma, and Barrett esophagus at duodenal junction is seen causes adenocarcinoma. Carcinoma in testes without shadow is germ cell tumor. MCQs 1. Which of the following appears opaque on X-ray? Oxalate. Testes of 30-year-old man shows echogenic foci without posterior causing shattering. This condition is associated with which of the following germ cell tumor? Echogenic foci without posterior shattering is called testicular macrolithiasis, and is associated with germ cell tumor. 30-year-old male smoker with progressive dyspnea shows bullae in bimassive region, bilateral spraying of upper lobe, L1 antitrapsin deficiency. Spraying of upper lobe bullae, L1 antitrapsin deficiency. 4. Pain and position headache shows T1W hyperintensity, mass in ventral part of third ventricle, paralysis. A female patient with 6-week amenorrhea, history of PID, pelvic disease, pelvic pain shows an axonal complex, cystic lesion, suspended gestational sac, diagnosed ectopic pregnancy. 6-week amenorrhea and then pelvic pain, an axonal complex lesion, suspected gestational sac, diagnosed ectopic pregnancy. Number 6. Recurrent thyroid plus cardiopulmonary scintigraphy, cold nodule in child is likely to be malignant. Recurrent thyroid and cardiopulmonary scintigraphy, cold nodule in child is less likely to be malignant. Payment ovarian malignancy with limited pelvis but unseparable from uterus, it is stage 3. E stage 3. Patient with over 90 with limited pulse and cerebral from uterus. This stage 3. Involvement of uterus stage 3. 8. Antenatal scan shows ecogenic mass infusion chloride pushing the peritoneum with no abnormal blood supply. Abdominal circumference is normal. CCAM. In the antenatal scan, ecogenic mass in thorax pushing the peritoneum with no blood supply. Diagnosis sees congenital cystic adenoma malformation. 9. Patient with bilateral hyalin and right parotid lymphadenopathy with no normal LDH and ESR state of sarcoidosis. P. Stage 1. Bilateral hyalin lymphadenopathy. On MRI, globus pallidus appears hypertension on T1 and apparent T2. Diagnosis of carbon monoxide poisoning. Involves the globus pallidus. 11. Which of the following doesn't show hypertension on T1? No unporty content. 12. On antenatal scan, fetus has short femur cranial dictally and thickened neutral translucency, Down syndrome. 13. Sites of avulsion fracture, memorized sartorius, rectus femoris, and iliopsoas. Sartorius anterior superior leg spine, rectus femoris from anterior inferior leg spine, and iliopsoas from lesser trochanter avulsion. Iliopsoas, lesser trochanter femur. 14. Patient presents a history of headache. There is a mass and body of lateral ventricle which is isolated on T1 and T2 and so hypomotility enhancement, coiled plexus carcinoma. Which mass and body of lateral ventricle? Hemangioma. History of headache, mass and body of lateral ventricle. When trichoma of lateral ventricle are two tumors, meningioma and coiled plexus carcinoma. There is a mass in the body of lateral ventricle. Diagnosed meningioma. 15. Patient known case of VHL shows cystic mass in pancreas with central scar, carcinoma. 16. 28-year-old patient with hepatic mass showing calcification plus central scar, which is hypertension on T1 and T2. Alpha fetoprotein is normal. Diagnosed fibrolaminar carcinoma. Hypertension on T1 and T2. Fibrolaminar carcinoma. It has fibers, so it's hypertension on T1 and T2. 17. 28-year pregnant lady shows a mass in liver after 4 weeks of repeat scan. It has increased in size. Most mass shows enhancement on arterial phase adenoma. Enhancement on arterial phase adenoma. 18. Patient with hepatic mass showing central scar, which will increase uptake of sulfur chloride, pulmonary hyperplasia. 19. Mortality rate from aortic dissection first 24 hours is 20%. 20. Schwarz-Karpelzinen still disease. Schwarz-Karpelzinen still disease. 21. Common manifestation in primary hyperparathyroidism is 50% subparastute reaction. 22. Patient presenting with hemoptysis, tractus stenosis, multiple pulmonary apathys, calcitations, pyrenotic. 23. Stomach commonly involved by non-Hodgkin lymphoma. 24. Patient with weight loss plus melena shows normal colonoscopy. There is hyperintense lesion in jejunum, leiomyoma. Weight loss plus melena and then hyperintense lesion in jejunum, leiomyoma. 25. Patient with reflux plus stricture is associated with Barrett's esophagus. Patient with reflux plus stricture is associated with Barrett's esophagus. 26. Patient with chronic renal failure plus renal transplant shows which of the following gastric ulcer. 27. Patient with liver transplant shows which of the following complicated most commonly hepatic artery thrombosis. 28. Patient presented unwell with abdominal pain, bilious vomiting. They had previously suffered from episode of acute cystitis secondary to cholesterol. On this occasion, initial investigation showed abnormal liver function test and a plain abdominal radiograph from serum alias. Surgical team requested a CT and you concerned of the possibility of biliary enteric fistula. Contrast enhanced CT was performed and pneumonia was noted. For other features of most support diagnosis of biliary enteric fistula, shrunken gallbladder, mimicking a diverticulum of the duodenal bulb, section from master path. 29. Which of the following shows a double density on bone scan? Osteoidostoma. 30. Most common meningitis salivary gland tumor in children, leukemia and in adults worsen. 31. Radiopharmaceutical for investigation of salivary glands. 1699 and Project Documented. Tier 2 pain has brain aneurysm and MCA and intracerebral bleed where likely is the bleed going to be subarachnoid phases. Tier 3 pain has hydrocephalus, which most likely abnormality will you look for meningeomyelocele. Pain is hydrocephalus, which most likely abnormality will you look for meningeomyelocele. Tier 4 definition feature of tuberous sclerosis is multiple calcified cortical tubules. 35 pain with groin crackling, stole bilateral hinged optic nerve, NF1. 36 pain with craniotomy, AV fistula, investigating choice is intraarterial catheter angiography. 37 etiology of pelvic stenostasis.